Okay, I have an update on this open reduction internal fixation that I had done a year and 1 month ago. To make a long story short, I had unnecessary metal plate surgery on my tibia pylon fracture because the sneaky snake, evil, creepy doctors, they don't give you any casting option. Always remember, you do not need metal plate surgery. There is always an option where you can choose to have a cast on your leg. You don't want to introduce any unnecessary stress to the soft tissue because that is the biggest problem that you're going to have besides the ugly scarring. Now, here's the metal plate that was maliciously put in my leg, and I received it from the doctors along with 13 screws. They didn't give me the screws. I have no reason. I have no idea why they didn't give me the screws. Okay. I was in horrific pain for a year. They told me I had to wait a whole year to have this metal plate and 13 screws removed. Coincidentally, there were two plates in there. The other plate, I have no idea where it is. I think it's still in my room. I was in horrific pain for over a year. You will feel that evil metal plate in there. It will burn. It will sting. It will cause you to walk with a limp. You will feel the stabbing pain from all those screws. That plate in alone is a horrible feeling to have inside your leg. Horrible. I feel so much better now, even though I'm a little stiff from all the stitches and everything. But I'm due to have the stitches removed tomorrow, and I feel so much better just having that out of my body. Don't ever let anybody trick you into getting metal plate surgery that you don't need. Okay, when they put an external fixator on your leg, that means your bones have already been lined up correctly. So when you have the um, bones lined up correctly, you can transition from the external fixator to a cast, an air cast, or a metal boot. Um, so I'm going to show you my x-rays with the external fixator on there to prove to you that I did not need metal plate surgery. Now, I don't know if this image is altogether that clear, but here is my leg. What are we doing? Oh, here's my leg, and the fracture is more or less right there. And as you can see, the bones are lined up correctly, 100% correctly. So I did there. There's the here. Let me point it out to you. Here's the external fixator over here, over here. Here's the fracture area right here, and you can see that everything's lined up correctly. I did not need no metal plate surgery. Was not given a cast option because this bill was actually $115,000 for the sneaky, creepy, evil metal plate surgery. Try walking around with this inside your leg for a year and 13 screws. And and you want to know, you want to feel pain. Um, do your own homework. Get your own set of X-rays from the hospital. They will have your X-rays on CD. Take them home. Review them on your computer. In my case, I did all my homework after the fact because when he put the metal plate inside my leg, and I realized how much pain I was in, then I started to do the necessary homework that I should have done before I agreed to have any metal plate surgery. You will see all kinds of videos from these creepy, no good Jew doctors on YouTube promoting metal plate surgery, but not a single one of them will tell you how horrible it is, how painful it is, and how invasive it is, and how damaging it is to your soft tissue. My soft tissue is never going to recover 100% to where I was before this fracture. And another thing is, you don't want to put yourself through any surgery because there's risks involved in surgery. You could get infections. You could lose your limb. There's so many complications with surgery. If you don't need surgery, don't let any sneaky, creepy doctor trick you into getting metal plate surgery. Um, Go get multiple opinions from multiple different doctors. Go see your primary care physician. Even though he's not an orthopedic, he can x-ray your fracture and he can give you an honest opinion because he is a medical doctor. And with that, then you have then you've been educated. Now you have an educated opinion as to what needs to be done and why. And I hope this video is informative to anybody. The biggest problem with people is because they are stupid and they believe everything that these creepy, evil doctors are telling them, and that's how they get stuck. Because once they perform surgery on you, the damage is done. There's no reversal on any kind of surgery. Once you let them cut you open, you're done. The damage is going to be done. You can't sue them because you sign a paper before you have the surgery. I agree not to sue. Blah, 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 sue. I have the paperwork. I hope this video is informative to anybody that has a fracture and is looking to get better and back to health. All right, over and out.